Respiratory tract infections in children. Respiratory tract infections are among the most common illnesses in children. They can range from mild to severe and are classified based on the part of the respiratory system affected. 1. Types of respiratory tract infections. RTIs are generally divided into two categories. Upper respiratory tract infection. Lower respiratory tract infection. These involve the nose, throat, and upper airways. These affect the lungs and lower airways. Common examples include common cold, characterized by runny nose, sneezing, sore throat, and mild fever. Common conditions include bronchitis, cough, chest discomfort, and fatigue. Sinusitis, inflammation of the sinuses causing congestion and facial. Bronchiolitis, wheezing and rapid breathing, especially in infants. Pharyngitis, sore throat, difficulty swallowing, and swollen glands. Pneumonia, high fever, chest pain, and difficulty breathing. Tonsillitis, swollen tonsils, fever, and throat pain. Croup, barking cough and stridor, a high-pitched sound during breathing. Laryngitis, hoarseness and loss of voice. Causes of respiratory tract infections. Viral infections, most common. Bacterial infections. Other causes. Respiratory Syncytial Virus, rhinovirus, influenza virus, parainfluenza virus, adenovirus. Streptococcus pneumoniae, Haemophilus influenza, Mycoplasma pneumoniae. Fungal infections, rare but possible. Environmental irritants, e.g., smoke, allergens. Symptoms of RTIs in children. Symptoms vary depending on the severity and type of infection but may include fever, cough, dry or productive, runny or blocked nose, sore throat, difficulty breathing or wheezing, fatigue and irritability, poor appetite or feeding difficulties in infants. Risk factors for RTI. Crowded environments, like schools and daycare centers. Weakened immune system, due to malnutrition or underlying conditions. Seasonal factors, increased cases during winter. Age, infants and young children are more susceptible. Exposure to pollutants, such as second-hand smoke. Complications of RTI. Diagnosis of RTIs. Clinical examination, history and physical examination. Blood tests to identify infections. X-rays for suspected pneumonia. Nasal swabs, to detect viral pathogens. If untreated, RTIs can lead to serious complications including ear infections, otitis media, chronic respiratory conditions, asthma exacerbation, sepsis, in severe bacterial infections, dehydration due to poor fluid intake. Treatment options for RTI. Supportive care. B. Medications. C. Hospitalization. Plenty of fluids to prevent dehydration. Rest and a balanced diet to support recovery. Use of humidifiers to ease breathing. Over-the-counter medications for fever and pain, e.g., acetaminophen, ibuprofen. Antibiotics, only prescribed for bacterial infection. Antiviral drugs, for severe viral infections, influenza. Bronchodilators, to relieve wheezing in conditions like bronchiolitis. Required for severe cases, such as respiratory distress or pneumonia. Prevention of RTIs in children. Regular hand washing with soap, ensuring children are up to date with vaccinations, e.g., flu, pneumococcal, avoiding exposure to cigarette smoke, using masks and practicing social distancing during outbreaks, providing a healthy diet to boost immunity. Conclusion: respiratory tract infections are a common concern in children, but with prompt care and preventive measures, most cases can be managed effectively. Awareness of symptoms, early diagnosis, and proper treatment are key to minimizing complications. For severe or persistent symptoms, consulting a healthcare provider is crucial.